Hi everyone, welcome to a new video. In this video, I'd like to discuss a little bit about what we can do if someone we care for example, cannot use their inhaler, if we cannot use our inhaler, if one of the patients we care about is unable to use an inhaler, because I'm not sure who might be seeing this video, but I'm trying to help with these videos to give you some practical tips on what can be done. So in this video, let's just talk about a couple of things that I think are quite important about this topic, because inhalers are very commonly used for respiratory disease, for chronic respiratory disease, and sometimes patients really struggle. Actually, most patients probably at some point in their life struggle with the use of an inhaler, and that's just normal because it's a medical device. It takes a little bit of training, a little bit of practice to actually get into the habit of using it correctly. So everyone wants the most benefit they can get from an inhaler, but sometimes it's not as easy to achieve as well thought of, basically. So let's look at what can be done. So first of all, I think it's very important to explain and demonstrate the inhaler technique correctly. So every time, for example, you see your doctor, you should be bringing your inhaler along with you to your consultation so that your inhaler technique could be improved. This is not a criticism, so basically if your doctor watches you as you're taking the inhaler, it can provide you with some constructive feedback. So basically if the nurse at the doctor's practice or the doctor themselves, they show you how to take the inhaler better, that can really improve the benefit that you're getting from the inhaler. So basically the other thing would be to be patient, because some people learn at how to use an inhaler faster than others, and that's absolutely fine. It's a normal thing. As I said, they are devices, they are medical devices. We need to get used to using them, and sometimes it can be easier or harder depending on the device, depending on the person, depending on how well they can move their fingers around. So there are a lot of factors that come into play when using an inhaler. The other thing would be, if you cannot really use an inhaler properly, correctly, because you're having difficulty synchronizing your breathing to the triggering of the inhaler, to the release of the puff. For puffer inhalers, so MDI inhalers basically, so metered dose inhaler devices, so things like Ventolin, for example, like the blue inhaler, they can be connected to a spacer, and this eliminates one of the steps because basically you're triggering the inhaler, it releases the puff inside this chamber, and then you inhale from the chamber, and basically you don't need to press on the inhaler as you're breathing in. So that sometimes can help a lot with improving the benefit you're getting from your inhaler. The other thing we could consider is, having explained everything, having tried all the technique tips and everything that we've been suggested to do, we can try to switch to a different inhaler. So this is where you talk to your doctor and you consider a different inhaler device. Now the good news is that nowadays, 2021, we have so many inhalers on the market. There are in this picture is, you can only see just a little bit of the range of inhalers that we have available. So basically we can always generally switch to a different alternative inhaler that contains more or less the same sort of active medication that can treat our condition. So it's not really an issue to switch in most cases, and some patients actually prefer to choose which inhaler they like. So I generally consider showing my patients a range of inhalers, and basically they can choose the one that they prefer, especially if they have equivalent medication in them. So I think that's a great option if all else fails. The other thing would be to consider a nebulizer. This is a great suggestion basically for children and for patients who really struggle with their technique. For example, you could have patients who are slightly older, or they have some arthritis in their hands, they cannot really maneuver the device well. A nebulizer basically is a device where you load medication in a chamber, and then you press on a button. It's an electric device that generates a sort of a mist, an aerosol that you can inhale. So you just hold the mask to your mouth and you breathe in and out slowly, and that sends the medication basically deep into your lungs. However, nebulizers are not for everyone, unfortunately, because not all the medications in the inhalers have a correspondent solution that can be used in a nebulizer. But if all else fails, this can be an option. If the patient is really breathless, they can use one of these nebulizers in some cases to relieve their breathlessness. The other thing really is to consider whether the inhaler is really necessary. So like I said, I was showing you in the previous picture the nebulizer. So in some instances, I've seen actually this quite often, patients who are, for example, slightly older, And I don't mean any disrespect at all by saying that, but it's just sometimes as we grow older, we tend to accumulate medical prescriptions. So we tend to have medications for our heart, for our breathing, for our knees, etc. So sometimes we basically are prescribed a medications for COPD, for example, for mild asthma, and actually we cannot use the medication. We just have it on our prescription. It's released to us every month, and we have an inhaler at home that basically just gets renewed every month, but we never really use it properly. So we need to make a judgment call in that situation. Is that inhaler really necessary to be on our prescription, to pay for it, for example? Because if we really cannot use it correctly with an accurate technique, it's not really giving us any benefit, and we might actually get local side effects from it if we're not taking it correctly. So we need to make a judgment call whether that inhaler really adds to the treatment or not. And in most cases, for example, if we're just trying to relieve breathlessness, there are, for example, nebulizers that can be used rather than an inhaler that basically is hard to use and cannot be inhaled correctly. So I hope these tips help you. If you have any other questions, please leave them in the comment section below. I'm trying to really develop this channel, grow it slowly, and to provide useful tips for you. So thank you for coming, thank you for seeing this video, and I look forward to seeing you in future videos. All the best.